Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Health Talk brought to you by Mon General Hospital. If you're unlucky enough, or is it lucky enough, to be transported via ambulance from your home or wherever you happen to be and need medical attention, and you need to get to the hospital, did you know that information about your vital signs can be transmitted to the awaiting doctors ahead of time, even before you get there? We're going to talk about that coming up today here on Health Talk. Good morning, Kay.
Good morning, Jim. And we've talked about this before, the importance if you're having chest pains or you're with your loved one and they're having chest pains, don't try to drive them yourself. And we're going to explain why this morning.
With us in the studio, Dr. Scott Benson, an emergency department physician with Mon General. Good morning, Dr. Benson.
Good morning.
Welcome to the program. And we'd like to welcome back Dr. Bob Curtis, the medical director of the Mon General Emergency Department. Good morning.
Good morning.
All right, let's get into the subject here. As Kay mentioned, it is very important to obviously call 911 first of all when you feel something is going on. We've talked before about how important it is to get somebody who may be suffering a stroke to the hospital. But when the ambulance arrives, who's on the ambulance? What team usually arrives to our home or wherever we happen to be to start giving us immediate medical attention besides the driver of the ambulance?
Scott is the Mon EMS medical director, so I think I would defer to him, and he can talk about some of the unique capabilities that Mon EMS has.
Who's on board, Scott?
Well, we show up at the house wherever the incident occurs with a paramedic who is a specially trained emergency responder that has a wide array of things that they can do and a significant amount of scope of practice. The other person that will show up is an EMT, emergency medical technician basic, who also has a wide scope of practice that can assist the paramedic as well as treat patients primarily with chest pain or any of an array of problems, trauma, stroke, and so forth.
I hope that if we're home alone, we are able to call 911, but what if we aren't able to communicate what our problem is with the 911 operator? Does that determine what team you bring to our house to treat us, or do you always usually show up with the same team? We
usually show up with the same team. Most of the time, chest pain, shortness of breath, those are the two most common problems that are called into the 911 center. So we send an advanced life support crew, which consists of a paramedic as well as an EMT.
And you're able to find addresses pretty efficiently? Because the fear is, I live way up here at the end of the road on top of the mountain, and you're trying to tell. I guess you have certain ways of locating people, right?
It has improved.
Oh, yeah, it has definitely improved. There's no doubt. Mecca has a very advanced location system. We have GPS systems as well. And we have constant dynamic communication between the 911 center and ourselves. So, they'll be able to talk to the caller as well as communicate that information to us, past the red pickup truck and go, 2 houses to the right, simple directions such as that sort of outweigh technology.
And I would imagine you're jumping out of the vehicle with equipment to go into the home to start immediately.
Yes.
I mean, you don't have to bring somebody to the ambulance to start treating them, correct?
Yeah, obviously, we have a whole array of medications as well as a cardiac monitoring system that we actually take into the house and assess patients there at the house. And, we can get into the discussion about 12-lead EKG here in a couple minutes, but, we're able to do that 12-lead EKG if you're laying on the floor in the bathroom.
You're saying 12-lead EKG?
Yeah, what that
12 wires?
No, it's actually 8 wires, but it sends 12. Yeah. But you get 12 different views of the heart, if you will, based on the way that those leads are placed. And it shows you regional anatomy of the heart, which is the front of the heart, the back of the heart, the bottom of the heart, the places that can get affected when you have a heart attack. So we can see changes in the electrical activity and the shape of the electrical waves that would indicate someone is actually having a heart attack at that time.
Dr. Benson, I'm just curious about this because Jim brought up the comment of someone knows they need an ambulance, but in the meantime, they call 911,
Sure.
they place the call, but they maybe pass out, and there's no one else with them. You arrive on site. What rights do you have to get into that home? What measures do you take? I'm sure this has happened somewhere along the road. So what can you do at that point? Can you just go on in, or how do you handle it?
It's a multidisciplinary approach. Oftentimes what will happen is we have mutual aid. Mon EMS has mutual aid contracts with all of the volunteer fire departments. So a lot of times the volunteer fire departments can arrive, sooner and be able to treat the patients as well. We can enlist local law enforcement as well to help us, get through those, quote, barriers, if you will.
Mm-hmm. I'm sure the biggest problem in getting there is traffic.
Yeah, there's no doubt about it. Traffic is tough, and especially, with all the new stoplights in town, it sort of makes it sometimes a barrier. But, that's why we have the lights and siren, but we're still enlisted with significant safety precautions in order to navigate traffic. But sometimes it's a barrier.
All right, so if you're in the home, then you can hook up the 12-lead EKG to the patient where they are in the home. And then are you looking at this 3D views, or these views of the heart there, and then transporting that information to the hospital? How does all that work?
Well, the cardiac system that we use, the cardiac monitor, which has many functions, including defibrillation, which is when we shock the heart, or we can use it as a pacemaker for the heart as well. But as a cardiac monitor, we're able to hook up these leads to the patient, get that 12-lead EKG, and the paramedic is the first one to assess that 12-lead EKG.
So is he looking at a monitor screen?
No, actually it prints out a piece of paper, just like you would get in the emergency department, that shows the 12 leads. And our paramedics and EMTs are trained to apply the leads and then therefore interpret the 12-lead EKG as well. So they're the first ones to actually get the paper copy of this 12-lead. And it is the same tool that we use in the emergency department to diagnose an acute heart attack.
Do you have to use scissors and cut up a $100 shirt?
Only when necessary.
Only when necessary.
Are you at that point?
Life before fashion.
Right.
Are you at that point when you get into the home and you observe, you know what's happening, you start the process? Is that when you touch base with the emergency room? When does the time come that you have the emergency room in that home with you?
Well, like I said, the paramedic or the EMT hooks the patient up and does the 12-lead EKG. We use wireless technology to transmit that 12-lead EKG, just as you would get an email through your cellular phone or text messaging. We use data, basically. So we have a wireless modem actually in and attached to the cardiac monitor.
That's awesome. I mean, so my Wi-Fi at home's not going to interfere with that in any way?
No, not at all.
Okay.
And in fact, that 12-lead EKG is sent directly to a computer that's sitting in front of us as emergency physicians, and it gives us an alert that a 12-lead EKG has been done pre-hospital.
Yep, and that's exactly what we're going to talk to Bob Curtis about here in just a moment on the hospital end. But this wireless transmission of your EKG, is that county-wide? Has it worked everywhere?
It has worked. It has worked everywhere, actually. Mon EMS is the only service in the county that utilizes this technology, and the way that the wireless system and the data system is hooked up is that even if we lose service, it will pick back up, just like your phone would, just like your smartphone or cell phone would. It'll pick back up and send the rest of that data. The 12-lead EKGs, just file size, are very small, so it's very quick.
All right, so we're still back in the home. You've got the readings and everything, and you've determined that the patient needs to be transported to the hospital. So you get the patient stabilized, I guess, put him in the ambulance. What are you doing in the ambulance on the way to the hospital?
Well, we're starting IVs. We're following our state protocols as far as giving aspirin if it's not contraindicated. We give nitroglycerin, morphine, and fentanyl as required for pain control. And that EKG is already been flashed to the emergency department. And if it is a heart attack, that's when our process, our STEMI, code STEMI process is initiated.
When we come back, at the hospital, the information starts coming in on you as a patient. What do they, as the hospital staff, start to do to prepare for your arrival? We'll let you know in just a moment. You're listening to Health Talk on WAJR.
Health Talk. If you have a health-related question, call us now at 304-296-0041.
Later in the program, a few minutes from now, we're going to be talking with Nancy Orr, Director of Emergency Services and Observation, about the 2012 Greater Morgantown Heart Walk. So if you know somebody that's been affected by a heart attack, somebody who has indeed passed away from a heart attack, and you'd like to do something about it, then make sure you keep listening. Right now we're talking with Dr. Scott Benson and also Dr. Bob Curtis, and we learned what happens when you call 911 and you're having a heart attack, and the treatment that you get in your home and then in the ambulance on the way to the hospital. So, Dr. Curtis, you start getting information at the hospital as far as the patient and their signs?
Correct. EMS usually will call us and give us a report about the patient and what they've done, vital signs and things like that. And then the other thing that occurs is that EKG that Scott talked about is transmitted to the office where we work, and a little alarm goes off and we can pull that EKG up. And so basically we can see if the patient is having a heart attack on their EKG before they can get there to the hospital. And the value of that is, the saying that time is muscle with regard to a heart attack. So the longer the blood flow to the heart muscle is occluded, the more damage that can be done to the heart. So, we have a program, as do probably most hospitals now, to very aggressively treat a heart attack. So we call it code STEMI, and, basically that activates a whole, almost domino effect of people who will descend upon this patient prior to them even getting there. So, the cardiologist, the cath lab is activated, radiology lab, the nurses in the ED, the physician in the ED are all sort of on standby for when that patient gets there.
When you get the information from the 12-lead EKG, which is, like he said, all views of the heart, can you tell what's causing the occlusion from that? Can you see that there's a clot in the artery, or there's plaque buildup in the artery, or can you see that?
There are different patterns you can see on an EKG, and then associated with those patterns are correlating arteries in the cardiac anatomy. So if it's an inferior wall MI, the cardiologist kind of knows which artery he's going to go look at.
4 arteries, or there's a lot of arteries, but there's main arteries, right?
And branches, yeah.
All right, but you can see specifically which artery there might be a problem
to
in.
some degree, you can see that. I mean, the pattern that you see on the EKG correlates fairly well with certain arteries of the heart.
Now, have they already started the blood going through the heart again? I mean, the EMT guys.
No. The EMS people are giving aspirin, which does sometimes that's enough to reestablish perfusion, but not always. So basically the cardiologist can go in, localize what artery is occluded, and then has different options that they can stent it, they can angioplast it, or they have other things that they can do to reopen that artery to establish blood flow before there is significant muscle damage.
Now, if we hear of people, she had a massive heart attack, she stood up and died, fell to the floor and died. Massive heart attack is just that quick. Well, other people can have a heart attack, get treated, and go back and live normal lives. So those people that have the massive heart attack, is there just something that all of a sudden stops the heart from beating? It stops blood from pumping?
Probably that's more an arrhythmia that causes some problem. And again, that's one of the reasons it's important to have EMS transport you, because they're monitoring your rhythm. If you fibrillate, they can shock you back into a normal rhythm. That's probably more commonly what's the cause than the heart attack leads to cardiac irritability, which causes that arrhythmia.
So I see that you're waiting in the emergency room for the patient to come in with anticipation. And next thing the patient comes in, you know a lot of information already about that patient.
Right.
And you know immediately where to take them and how to start the treatment.
So our goal is to get the patient, who's having a heart attack, reperfused by the cardiologist in 90 minutes or less. So what this does is it gives us a great lead time. I mean, we already have the EKG, we've already activated the cath lab, so we're knocking significant amount of time off the care of that patient. Whereas if somebody walks in the door, we've got to get them in a room, get them undressed, put in the IV, start the oxygen, initiate some of the medications that EMS has already done, do their EKG. All that has been done ahead of time. So that's a significant time savings, and in terms of mortality and morbidity, again, the quicker we can initiate aggressive treatment, the better the outcome.
All right, and a final question for you is, how much of an advantage do you think Mon General has in being able to transmit this information wirelessly to the hospital ahead of the patient?
This is, again, a huge advantage. Other systems only show one lead. We're getting 12 leads. So the likelihood of us knowing what's going on with this is much better than, without anything being transmitted. Then, basically what happens then is the patient comes in and we'll run the cardiogram, and then we'll call the code STEMI. So you're losing that time. You're losing 5 to 10 minutes probably. And in the future, we may just go directly to the cath lab. That's, it may not even stop very long in the emergency room, bypass the emergency room, because all that information and data, as Scott was talking about, is already, what we normally would obtain in the emergency room, we already have before the patient has arrived.
Final question. Kay, did you have a question?
No, none. I'm
All
just
right.
sitting here listening to you,
You can
Jim.
talk with Nancy coming up.
That's all right. I'm just listening.
All right, I'm going to let you talk with Nancy.
No,
when
you
we
go
come
right
back.
ahead. I think
All
you
right.
ought to talk to Nancy.
I totally occluded Kay from that segment.
I had so many
Speaking
things I
of
wanted to
occlusions.
ask, but not as important, I'm sure.
You're absolutely right about that.
That's
It's
right.
8:55. We'll be back after this.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Welcome back to Health Talk here on WAJR. Jim Stallings along with Kay Murray.
You're too bad. You are. I know Jim's interested so much in this, and when you experience losing a loved one, I think you're so full of these questions because they come from inside of you. You have all these questions. You don't know quite where to go with them. And I know Jim's mom just passed recently, and of course we lost a very dear friend, Lorraine Robinson, this year. And we, it just comes to, you get somebody that goes so quickly, it's hard to accept that. So we want to get people who have suffered this year and others to be a part of the Heart Walk coming up. And Nancy, tell us when it's going to be and how can we get involved?
Well, the Heart Walk is going to be Saturday, October 27th. Registration is at 9. The walk is at 10. And we would invite members of the community to join us. If they'd like to, they can call me. We can get a packet for them. If they want to get a team together, if they don't have a team, if they'd just like to join one of ours, we would open our arms to them. They can call me at 304-598-1202. Mon General has partnered with the American Heart Association to become a platform sponsor for the next 3 years. Our CEO, Daryl Duncan, and one of our cardiologists, John McKnight, are the community leaders, which is pretty fantastic. This is the second year that Daryl has stepped up to the plate, and Dr. McKnight. Everyone knows someone, whether it's a loved one, a friend, everyone has been touched by this. And the goal of the American Heart Association and our goal is to decrease heart disease by 20% by the year 2020. So we're working on that. And actually, we're talking about the EKG transmission. We're actually going to do a demonstration at the Heart Walk of that.
All right.
So,
It's coming up on October 27th, so there's still plenty of time to get some money raised if you'd like to walk for the American Heart Association. Thank you all three for coming in today. We certainly appreciate it. You've been listening to Health Talk, brought to you by Mon General on Full Service 1440 WAJR Morgantown.